But I'm Peter Lacey. I came across System Dynamics 25 years ago. I joined the health service in 1990 at what were then called regional health authorities, and there was a project going on around the closure of long-stay institutions. And one of our managers said, well, we need some sort of systems thinking here. When you sort of scratch the surface, they knew somebody, and et cetera, et cetera. So I was a project manager on a piece of system dynamics modelling about 25 years ago. I picked up the tools, the basic skills. It fitted with, I suppose, my training and background. My skills, I suppose, were in management. I did an undergraduate degree in geography and theology. But then did meteorology as an MSc. Now, if meteorology isn't about three-dimensional modelling of complex systems, then I'm not sure what is. But I wasn't really technically able enough, so my bent towards the sort of technical, the mathematical, and the physical wasn't strong enough to take me down the wonderful green pastures of weather forecasting. So I went into Marks and Spencer's management training, regional health authority. And I'm really picked up that sort of management and systems, very sort of simple level of systems thinking offered by System Dynamics. And most of you will have some, I'm assuming that most of you will have some familiarity with what System Dynamics does. My contribution today is, I suppose, to try and describe a way in which I'm exploring some of the complementarity, some of the ways in which we might nest different tools within different ways of thinking. I've sort of, a bit like learning Greek, I tried 3 times and still can't do it. VSM is a sort of, I've been introduced to VSM 3 times and I'm starting to get it. So I can do my basic sort of translation, if you like. But it's a fascinating world, and I can certainly see the way in which it can frame and therefore do that sort of diagnosis stuff really helpfully. But what I'm hoping is that my presentation will provide a context. I'm not going to go into the sort of background of theory. There is, if these slides are circulated, which is fine, some basic stuff in terms of what System Dynamics is. I'm not going to go over that in detail. I've actually brought some of the booklets that we've produced on the table there about the work that we've done over a number of years. Oh, we're going to have a mic as well. Does that mean it's just... Great. Is that better? Might be. I'll say a bit more. I'm not going to say it all again. Oh, better. It's on as well. So synergies, hybrid approaches, thinking about system dynamics as a contribution to a field of systems thinking. And I'm here as much to learn today as to contribute. And I always think it's useful work. So this is potentially a new perspective. Who knows where this is? Who can identify those hills?
England.
Is England? Yeah. Not Wales.
Yorkshire.
It's
not Brigham Rocks, is it?
No. So I'm from Yorkshire. What you can see, Ingleborough. Excellent. So the one in the middle is Ingleborough. Yeah. And Penigent.
And Whernside.
Yeah. Okay, so the 3 peaks in the Yorkshire Dales, which I've walked a couple of times. But the new perspective is that this is taken from the west, looking east. So we went away on a weekend and we were walking in the hills, and I suddenly realised I've never seen the 3 peaks like this. I've seen it from sort of the other side, if you like. I've done quite a bit of walking in the Yorkshire Dales, and I can recognise those 3 peaks from most directions. And in fact, I could recognise them, but I'd never seen them stacked up in this way before. So just a little illustration. New perspectives, maybe today you will sort of see the world of systems thinking, system dynamics, if you like, in a slightly new perspective. Like VSM, it's really simple until you go under the bonnet or until somebody gets really academic about it. And your comment about the sort of academic bent, there is within system dynamics quite a strong sort of academic, sort of fraternal, and I try and engage with it constructively, but wish it was slightly less balanced towards the academic. think sometimes it can cause challenges that shouldn't be there, or take longer to do things. But there we are. I often call myself as a closet academic because I can engage and think academically, but if I had to do a PhD on one subject for 3 years, I'd probably go mad. So I've sort of dipped into lots of other things, polymath rather than single concepts. But there are two things. I'm just going to introduce them to you briefly. Influence diagrams and stock and flow modelling. So there is always within the system dynamics world that sort of synergy between the quantitative and the qualitative. Mentioned already, I think yesterday you mentioned the sort of bringing some of the quantitative modelling, and people often jump to the conclusion within system dynamics and the world that it's all about the stock flow modelling. And there's a lot of that, but it's not just about that. So I'm going to share with you a simple influence diagram. So what you see here is a strategy, okay? Targeting delivery on IMD hotspots. IMD, Index of Multiple Deprivations. You're in a council situation. You've done your geographic mapping. Your visualization is great. You've seen the hotspots of deprivation and all the sort of the stuff that means in terms of public sector services, etc., etc. And the stock answer, it is your strategy, your policy, whatever, is to target all of your delivery on IMD hotspots. So you bring together on the key LSOAs, the local sort of super output areas, so the 2,000 population, you bring your police and your social services and everything together, and you throw it all at this area of high deprivation. However, if you do that, and this is the start of an influence diagram, the more you target delivery on IMD hotspots, the more you actually encourage a culture of dependency, one could argue. Okay? The S there is the same direction, influence, if you're not familiar with influence diagrams. So one goes up, the next goes up as well. If your culture of dependency increases, the ability of that community to cope and thrive reduces. If the ability to cope and thrive reduces, health and well-being outcomes also reduce. Same direction influence. And if your health and well-being outcomes become poorer, then your tendency to target increases. And all you've got is a reinforcing race to the bottom influence diagram. That's the description. We target traditional delivery. We actually create a greater sense of dependency and a community's ability to cope, and outcomes get worse. So you've got the sinker state. Sink is very sort of visual language, isn't it? And I put a little word there, sort of commentary, if you like. That's a classic reinforcing loop that will spiral ever downwards, and it requires a different point of intervention. And often when you sort of describe these, this emerged from a simple conversation between me and a new employee within Health Systems Partnership. We're a team of about 7 or 8 core and half a dozen associates. We've just taken somebody on whose background is in local authority, sort of community development and children's services. And he was just describing this to me, and I said, well, there's an influence diagram. We can describe this very simply, what you're telling me, as this sort of process. And what then emerges is that there's a different strategy. And the strategy is a point of intervention, which is actually your point of intervention rather than being on the sort of bringing everything together, targeting, etc., which is a very sort of structural organisational response. It's rather to what is commonly known as adopting a strengths-based approach to community development, community assets, and focusing on building independence, if you like, and self-help and acknowledging the assets within the community. And if you then start at that point, so if we tell the story differently, and we say what we're going to do is intervene to address and improve or sort of redress that culture of dependency, then that reinforcing cycle, I won't run through it, but you can see it flips and it becomes a virtuous rather than a vicious cycle. So influence diagrams are really helpful. I draw quite a lot of simple, either reinforcing sort of one loop pictures. When we do training, we start to pull them together. There are archetypes that emerge. Peter Sengley's work is the classic in that area, and all the sort of classic sort of race to the bottom or sort of fixes that fail, a whole range of things that just build the sort of archetypes. And so just in the same way as you've got a picture in your head with VSM, you've often got, I've got pictures in my head in terms of what's actually going on within a system, and how can I diagnose through a simple combination of influence diagrams such as that. Second element is of course stock and flow. So this is one section. It's probably about a sixth or an eighth of a model that we're working with at the moment around local service transformation within STP land. It denotes a population. You've got two stocks here, and I'll just point out one or two things in terms of how this also talks about delays and feedback, because those are the common, typical sort of highlights within a system dynamics world. What you've actually got going on here in the top stock, if you like, is an overtime visualization and modelling, quantitative modelling of the frail and complex needs cohort within a given area. In this case, it's about 14,000, happens to be West Kent, and what we've got there is an indication from the local data, from their sort of data mining, their use of an electronic frailty index and the like. We've been able to sort of triangulate their data and say, well, did you know, and they didn't know this, not only that, what they knew was that there were about 14,000, because you do a spot check, don't you? We've got the electronic frailty index now, we can tell you. But if I were to ask them, and how many does that mean new frail people every month? They wouldn't have a clue, wouldn't know where to start. What this does is just help us to think about that. It's about 40 or so. And then we say, well, what's the consequence of that frailty and complex needs cohort growing? If we know that we've got about 40 coming in every month, what's the outflow? So you start to get into some very simple sort of stock flow language, and through, in effect, a triangulation process, because we can't know who's going to die exactly when. We say, well, actually, as well as 40 coming in, only 38 are going out, and that's why it's growing. And that, for some people, is a huge insight, because what they've done in this instance, actually, they had an idea of the 40. I'm not sure how they got there. I think it was a fact packet. But the second thing that they'd then done, which this modelling helped them to do, was to realise that actually, if the answer was 40 new, frail people within their population, and they started to identify 40 a month, if that was their target, if you like, 40 a month, then they'd be okay. They'd have covered their population. Anybody sort of quickly tell me why that might be wrong? They haven't dealt with the backlog. Okay? So if you capture those 40 and there's 38 dying, it will take you decades and decades to actually be scratching the surface of the need, because all you're doing is addressing the sort of throughput, if you like. So what this does in the bottom half is say, well, if you switch on a new strategy for identifying and capturing, then the cohort, there is a delay in that process. We've calculated very crudely that based on those figures, the average time within that stock of complex and frail needs was, depending on the geography, this was about 7 years. Average years in cohorts, you'll see there. And we've got a feedback mechanism there that says, well, what you need to do is have a mix of a strategy that is about identifying people sort of on the threshold of frailty, so that we can identify and do the preventative work that you want to do, but also recognise that you're going to be capturing through that process people who are already frail and may actually be quite close to their last year of life and death. So that's a factor. So this started to sort of bring to life some of the numbers that people were working on and putting into their business cases for the new developments within multidisciplinary working in a locality basis. And it actually got them thinking very quickly about this number 40, and we sort of scaled it and said, well, for the first 18 months, you'll need 50% more capacity. That'll get you some way to sort of more than just scratching the surface, and then you find an equilibrium in the longer term. So it helps people to think about transitions within a complex system that is about delay and feedback. So as I say, we sort of go under the bonnet occasionally. I haven't got a slide, but the interface is normally sort of, I know it doesn't match the sort of ambition of visualization, it's sort of standard sort of graphs and delays and the likes, but it provides a behavior over time that says something about the structure of the system that you're starting to analyze and work with. So that's just the two key building blocks, influence diagrams and stock flow modeling. Where we're embedding it at the moment, we've been, as I say, I've been doing this for about 20 years, and there's always that sort of ambition to embed the skills and the knowledge within organisations. It's the standard sort of a little bit of reference to it today. You go in, you do a piece of work, you go away, and it's either on the shelf or people didn't understand it, it was too complex, etc. There's also something about system dynamics being relatively underused for its potential, certainly in the health and care sector. So we're working at the moment, the Health Foundation saw it in their good, in their wise ways to fund an advancing applied analytics community of practice in Kent, which we are providing the main sort of input to. And what they wanted and what we wanted to provide for them was what we've called a critical appraisal framework that is about, in this wealth of modelling and analytical options and capabilities and tools, how and when do you use system dynamics? So I thought this might be, I've got some case studies later on which we'll talk through, but I thought this might be particularly useful for this audience because one of my ambitions here is to try and see how system dynamics fits within a whole sort of toolbox of tools, if you like, rather than just say system dynamics will answer all your problems, because it won't. And critical to deciding and working through where and how you should use system dynamics is the nature of the questions that we ask. So this is just a sort of quick run through what is beginning to be slightly broader, sort of more detailed critical appraisal framework. On the left there, the context for the question. And I was thinking actually when you were doing the simple intro to VSM, that sort of prior thinking of VSM could help significantly to sort of pigeonhole where the questions that you're wanting to ask are. But it's also about timeliness. When do we need the answer? What's the nature and quality of the data? Can we do this? Or do we need to gather more data? What's the level and type of skills required to answer the question? So these are all sort of preliminary questions, as well as wanting to know, well, what's the answer? What are we going to use the answer for? Are we just interested in visualizing and understanding the system with a few numbers in it? Or are we redesigning and sort of thinking through? I was at a conference in Cambridge back in the autumn, which is very much emphasising the design side of the use of systems modelling and systems thinking. Or is it to test out our assumptions about the expected impact? We just need something, we've got a sort of sense of how something will work, but we haven't got a way of sort of turning that into an evidence base, if you like, using evidence loosely. Obviously, are any of those negotiable? So we're very clear in system dynamics modelling about the need early on to frame that question and to identify that high-level list of model design specification in terms of what we're actually modelling, the level of granularity, etc. I suppose that's the equivalent of what level within VSM in terms of where's the locus, where's the system, what's the system and what's the environment, what do we need to actually answer. And we've produced a very sort of, so this is American baseball rather than ice hockey. We produced a baseball analogy down the left-hand side. Very simply at the start, is it a question that requires analytics to answer? So bear in mind this is for a community of analysts. And when I drew this the first time, I sort of, I think what purple line or whatever was over there, and somebody sort of stuck their hand up. I'd like to see more analytics, so can you move that over here? But I did want to emphasise the fact that sometimes it is perfectly reasonable to go with gut, particularly if it's a quick answer that's needed. But assuming that there's a lot of questions that we ask within the strategy or the operational field that require analytics, we've got to hit where we're on our way to first base. There is then in the second tier there, I don't know whether you've come across the Gartner analytics continuum. It talks about how we use data and analytics, and we can do that in a descriptive, a diagnostic, a predictive, or a prospective sort of way. And we're looking towards the sort of right-hand side of that. So what we've done is developed a few sort of tester questions about whether that's what we're looking at. System dynamics sits towards the right in each of these cases. Then again, we'll probably all be familiar with sort of complex adaptive systems, which is very much at the heart of BSM. What is the level of complexity? Let's be clear that this problem is genuinely wicked and messy, that it is complex, not just complicated. Because what we don't want to do is sort of spend a lot of time training you and teaching you how to do system dynamics, but what you want is actually something that's much more at home on the left-hand side. And then we talk about the distinctives around, this is getting a little bit more sort of technical, small t, the different modelling approaches, discrete event, agent-based and system dynamics, and increasingly how even those are being used in a hybrid way, linking across. The software tools that are available now are much more flexible. We use Stella software, which used to be iThink, and within Stella it's becoming quite easy to do some simple agent-based modelling because of the flexibility of the tool, and even to build models that combine the sort of population level with that individual behaviour, agent-based elements. So if you get to the bottom right-hand corner, basically we said you're on a home run, and system dynamics is the right tool, so that we're not trying to take over the world unjustifiably, but using it in the right sort of context. This will be fairly standard. You'll see the reference there to Sally Brailsford down in Southampton University. Just a very simple sort of checklist again about when system dynamics can be helpful. Strategic, large quantities, managing systems through rates, long time scales, and the sort of policy questions. So I suppose here we are dealing with the system, the subsystem 4 and 5, I suppose, but in a way that engages with the lower subsystems. But it's not something that within BSM, SD necessarily use to answer detailed operational questions for which there might be perfectly appropriate quantitative modelling skills and tools available. I mentioned the sort of desire to think about hybrid and sort of combined approaches. I just list 4 here in terms of what I've mentioned already, sort of integrating agent-based and SD modelling. We've done one project in Hillingdon, so that's Hillingdon, not Hillington, West London, where we've actually worked with Simulate to build. They were building a DES model, we were building an SD model, and we were allowing the models not sort of automatically communicating, but through a human interface, saying, well, the SD is telling us certain things about the system behaviour, which is helpful to understand how we initialise a DES model, and vice versa. Sequential, we've sort of pointed towards this in some of our work, where SD is particularly useful when you haven't got as much time, and that might still be 3 or 4 months in terms of investigation, model building, sharing, engagement and the likes. DES and agent-based to some extent are much more data hungry, and therefore requiring sometimes of more elapsed time. So what we've done occasionally is said, well, what you need is an SD model to explore the nature of the system, and then we need to identify that you're going to go off elsewhere or use your internal skills to do more detailed sort of sequential modelling part of that process. And then there's a sort of whole nesting approach. The KID that's there, sort of 3-letter acronym, the Kent Integrated Data Set is basically the place where we can data mine to inform the assumption building for system dynamics. But that sort of KID analysis is towards the sort of middle and to the left of that previous framework picture, where you're doing sort of diagnostic type analytics rather than prospective. So trying to put system dynamics within a wider frame. And the final slide for this, and I'm going to pause and allow for some questions and then a little poll as to where I go next. This is sort of self-directing or group directing presentation. This is a paper published in the Journal of Operational Research last year, looking at 9 studies, I think it was, including one that we'd done that had been published a few years ago. These are the 5 sort of success factors, and I don't suppose they're particularly revolutionary or distinct from other engagements, but high levels of communication, the skills of the modeler, the responsiveness of the consultancy, if you like, because these were all delivered by consultants, sometimes internal consultants, but certainly there's a consultant-client relationship in each of these 9 projects. Importantly, and we have found this sometimes, the involvement of I suppose the key client stakeholder. Modelling, particularly quantitative modelling, can sometimes run the risk of being a sort of a technical task that you specify and then sort of wait for the answer, rather than a process that you're actually engaged in. So the 4th point there, involvement, engagement with the client and the relevant stakeholders, is that sort of point. And clearly the commitment and engagement. So there's something about both sides in the relationship there that makes a system dynamics engagement application successful. So I'm going to pause there for any sort of questions or insights, and then I'm going to give you an option of 3 case studies. Might manage 1 or 2, but all of the material can be circulated so you can see some of the areas, and I'll mention them more briefly. But questions or comments? Patrick?
If you can go back a couple of slides, you had one which was, no, after that. Control of the system is exerted through rates rather than queues. Could you just say a little bit more about
Yeah. So this is a reference. Sally's book is particularly around discrete event simulation and SD modelling. So if you see those put alongside each other, the mathematics that run a discrete event simulation tend to be around queuing theory, and therefore the distribution of people from a queue sort of system. So it's about the discrete event that causes a queue and a backlog. Whereas within a system dynamics model, the sort of picture that I showed you, the emphasis, and it's not to say that you don't do queuing within SD or vice versa. Yeah, it's just the emphasis and the where is your control of the system. So the control of this system is, I'll point to it on here, is here. So you're looking to intervene in a flow in order to change the dynamic and the behaviour of the system. Whereas if you were doing a discrete event simulation, it would be of a different subject. Then this might be constructed as a queue, and you're operating on the queue to optimise the subsequent sort of flow.
Here's a word about model validation. I can imagine these models are pretty complicated, of course. You have something that shouldn't be there.
Yeah.
It's doing something really weird. So
Yeah.
how do you go about validating your model?
Okay, so this is where you get a different answer from an academic to a practitioner.
Yeah.
Okay,
Yeah.
because an academic will refer you to the chapters on the steps, and the PhD students all go through them, and I've read and reviewed the documents, and they're very insightful. For a practitioner, the validation is as much the process, the engagement, the sort of the confidence and the sort of transparency of the model building process, the intuitive nature of whether it reflects the system behaviour, whether people are confident in the assumptions that you're building, which are often, because you're not modelling the data, you're modelling a system, and you're using a whole raft of different data, some of which is good and some of which is quite poor. Then it has to be the combined confidence that you and the client have that this is good enough for the purpose of the question that you have to answer, that you take that into account when you're making decisions based on the answer, because you're not expecting any of these models to come out with the answer 42 and just to blindly follow it.
Sure.
So the model that I showed you produces, for example, an output that is the required output for NHS England in terms of the saved occupied bed days in hospital against the do nothing 1 year against the previous. And the answer we've got is 13,300 and squiddly dot.
Yeah.
Now, the validation of that figure is that we've actually gone through a number of, we built the model, we got an outcome, we'd got an outcome. They thought it was somewhere around 15,000. That's what they thought. Initially came out with 25,000, and they thought, I'm not sure we believe that. Let's look at the model again. So we went back into the model, revalidated some of the assumptions. It challenged some of the bits that I'd modelled, so I tweaked it, but it was a sort of process of conversation. And we are now around the 13,500, and they thought it was somewhere around 15. Now that doesn't rule out the possibility that their 15 could have been completely wrong. And the insight might have been, well, actually there's something new that the model is telling us. But the validation process is very much sort of the process that you go through, the documentation that you leave people with, the confidence that they have that this is a model that they can operate with. You might get a different answer from an academic. Go on.
I love what you're saying about the agent-based stuff.
Yeah.
So if I've understood it, just from without getting into detail, I'm familiar with SCiO, and the fact you can use discrete events, they call it cycle time or whatever, but it's the same thing.
Yes.
Crude way of doing. When I tried to apply it to agent-based model, in other words, people talking to each other and things, I've really struggled with that and to make the investment in any logic, which has done my head in.
Right.
How, just in essence, how do you do
Very
it?
simply, but I can give you an example over lunch of one that's working, and we're experimenting with it. So basically, technically, what you're doing is building an array of agents with the ability only to have one person in each stock, each array of the stock. So you're filling up an array of stocks, and the attributes that are appropriate for an agent are the converters that you build that also are arrayed. So you've got 100 people within a model, or up to 100 people. They come out. Well, what we're conceptualizing and starting to build is it's a case study with somebody at the business school in Hull. Is a falls pathway. So you've got a population that's susceptible to falls, but when a fall happens, then from that flow, they become individuals. So we have an up to 100 array, if you like, but each individual may have a different and possibly randomly selected set of characteristics. So what's their age, what's their bone density, whatever those are. And it also comes back, one of the reasons why we want to go that way is that you can also then start to add some of the qualitative elements. So for this person who's had a fall, what's the nature of their caring support in the community? Well, that's an attribute that they have. It's not a physical, quite in the same way, quantifiable asset. It might even be a yes/no. Do they have a carer at home or don't they? But we know that sort of thing makes a real difference to the individual recovery time. So that will come into an agent-based element of a SCiO model. And I can show you one that's actually, you can find them on the IC website as well, because they're starting to sort of demonstrate that capability. Okay? Other questions at this stage? Okay. Quick look, so I've got three case studies. I don't know whether we'll have time to do, we certainly won't have time to do three. Population health needs, Kent Hull population cohort model, 25, 30-year time horizon, smoking levels, obesity levels, hypertension levels going up and down all over the place. What happens if we focus on smoking cessation or on children's services, etc., on the long-term sort of potential impact of need and therefore service use within a population. That's the first one. Service transformation, cardiovascular services, fairly traditional sort of service transformation, but the distinctives here is sort of building the thread from the service transformation, the activity modelling into workforce. We've done a lot of strategic workforce modelling in a way that's sort of embedded within the service transformation. And then the third one, which is a particular passion and sort of the relational side, I've mentioned it already in that sort of falls case. Putting trust in your model is just a little sort of conceptual model about the importance of relationships and the behavioural side of systems. I've sort of voted myself onto the behavioural OR special interest group in the SD Society, and that's an interesting, in the OR Society, and that's an interesting experience. Far too much emphasis on nudge in my view, but there we are. So, votes. Just a very quick show of hands. Interested in number 1? Interested in number 2? Interested in number 3? Well, we'll definitely go to number 2, and then we'll take another vote, all right, if there's time. So let's go to number 2. Okay. So the question here, so you've got, if LLR comes up anywhere, it's Leicester, Leicestershire and Rutland. So that's the geography, Midlands, 1.5 million population. A community cardiorespiratory service is being designed. That will have an impact on pathways across the different sectors. You've got a very fairly sort of distinct cohort of need and traditional pathways in terms of hospital-based services, outpatient appointments, etc., etc. So the policy, the sort of service, the strategy direction is an integrated community cardiorespiratory service. But the sort of challenge, if you like, is how will it impact on the workforce? What's the strategic workforce plan? How do we actually work that through? Rooted in local plans, and the modelling outputs provide an answer to the challenge, which then sort of works through in terms of implementation. But let me run through. This is often where we, well, not quite where we start, but it's the sort of first staging post of an SD type engagement process. We're basically doing the sort of wall chart mapping of a system without trying to map every jot and tittle. And this is, I suppose, one of the sort of accumulated skills of somebody who's doing system dynamics, that they can get at the meso level that is sufficiently detailed to enable you to really genuinely understand the dynamics of the system, without getting into the sort of the micro level, which is very difficult when you're engaging with clinicians and professionals, because they think about the person who they've just seen this morning, and they say, well, and you're sort of asking them to think about the average person or the typical person or the sort of broad level of input. So this is a sort of typical meso level diagrammatic representation of a system with the sort of pathways through from a population with cardiorespiratory needs, which we can quantify, the ability to identify those within a population, so that's the sort of top left, the fact that we might do longer term preventative work, which would reduce the size of that population, depending on the time frame over which we're looking. And then we've got the sort of whole sort of left to right, an express need, the tendency, and this is behavioural often, when somebody has either a cardio or respiratory exacerbation, they will choose to turn up at A&E, to call their GP, to do various things, maybe even to ignore it for too long, depending on their sort of learned behaviours, and also depending on the nature of the systems that have been generated and created around them, and sort of public sort of education type exercises. But we can quantify that, and we can see how perhaps this current system is not ideally sort of suited, because we've got too many people, which is a sort of traditional response, too many people turning up at A&E, some of whom don't need to be there, some of whom they're at increased risk of hospital admission when there are safe and effective alternatives. This is a good example of the sort of design purpose of a piece of system dynamics modelling. They described a policy, and what we didn't do, whilst we looked for the current activity levels and the likes, what we didn't do was try and map their existing system and then sort of tweak it and change it. What we did was we mapped their future vision system and used their current activity and needs and pathways, whatever we could find, if you like, onto that to work out what should be in that dotted oval. Because the dotted oval, as you'll see there in bottom right, it's the boundary of that future community integrated service. They've got bits of it already, and this is often typical of us, certainly of a health and social care sort of transformation process. It's the NHS is the world's best at pilotitis. and you'll always find bits of pilots all over the place that answer part of the question, but aren't necessarily sort of embedded with a systemic sort of systems perspective. What you then see is the way that we've communicated the care functions, which is that sort of meso level. So there is each of those sort of star numbers are about we can describe what a crisis response number 5 there would be. We understand what an A&E, a CDU is, a clinical decision unit. Each of those are chunks of service delivery that can be quantified and we can move through. So that's a visualization. We sort of summarised that for people. We said, well, what's the nature and what's the sort of dynamic that we're expecting? Well, we're expecting this sort of much greater synergy between primary care and ongoing support with the community, with the central sort of new service in the middle. And we're also expecting the hospital-based services to be protected somewhat by that new community service in the middle. And we're saying there are care functions outside the community integrated service that are important. Care functions 1 to 3, which is the prevention and the likes, and also care functions to the right, if you like, of that system. But we're focusing on those intermediate care functions that this service will actually deliver. So now we've got letters, not numbers. They mean something different. Here what we're saying is, where are the points of intervention? Question Patrick asked, what did it mean about flows? Well, this is a classic, because what we're doing is saying at these points of flow within the system, we are going to do something different. We are going to provide a service or a signposting or a piece of, sometimes a piece of IT that will help people to move differently down the system. So A there is about using primary care for a first point of call rather than expecting an immediate sort of A&E attendance. That means that we need to support and train and develop that primary care workforce to do it. It's not just a sort of dumping, it has all sorts of consequences. B is about when we develop at an optimal level that crisis response service, it will change the flow away from A&E into a crisis response. So each of those are points of flow that we're seeking to impact. And what, again, within the health and care sector, what people struggle with time and time again is that they can visualize and understand and maybe even model with a spreadsheet each of those points individually, but they can't put them together. Because what you do at A will have an impact at D, but it'll be a sort of a filtered impact. It'll be both delayed and potentially reduced. So that was the sort of second thing to introduce folk to. We described what those were in words of England, just sort of simple language, and also in terms of the workforce. This was the end of the bonnet, and we often sort of. And the important thing here is not to get people to understand exactly how this works. Apart from the conceptualization of stop and flow is quite important and instructive. But it's really to say there is an audit trail, it's about validation to some extent. There's a proximity. I can say that is reflected in that. So we can say we are gathering the intelligence, we are populating this model in a way that reflects the picture that we've agreed between us is a representation of the system that we're exploring. And we build an interface, make it clear that these are the points at which we are intervening. We can have these switches on and off in any particular combination, which again gives people the opportunity. Going back to the West Kent model, there were 9 care functions that we've identified in that. And whilst the client recognises that they are not going to just turn 1 or 2 or whatever, they're not looking for which one to pull, they're looking for the relative impact of all 9, but they're going to pull them all. And the unfortunate thing in some of the sort of business planning that goes on in the healthcare sector, maybe a reflection elsewhere, is that the business case for one of the care functions still needs to have a sort of impact analysis on its own. It's not very helpful because there are other things going on. So that's an illustration of the sort of outputs. What the lines there are the workforce elements. I think there's just a little bit more on that. Scale of ambition. So you're constantly asking the question, about the scale of the impact that will happen at those 4 ABCD points. So we build them an interface that allows them to explore. It's a bit like, well, it is about sensitivity analysis, but it's not automated Monte Carlo stroke sort of 100 runs, although you can do that in Seller, and sometimes that's useful. But what you're trying to encourage is actually an engagement of the client with the model, and say, well, when I push this a little bit further, it does X and Y. How am I understanding and learning from that? Rather than just saying, here's a model, press the button, it'll run 100 times, and you'll get a nice funnel plot, although that's possible. And what it does, because each of those care functions, we've also done work with the client around, well, what's the skill mix? Then it tells us about what the overall shift of the workforce, the sizing of the workforce, which as you'll see here is a nice message because it's less workforce in the future than at present, but also about, and it's not huge but it's subtle, what the sort of changing skill mix is. And what we've done with strategic workforce planning in the NHS and social care is increasingly talked about skill levels rather than professional groups, and systems rather than organisations. So we move away from the initial sort of silo that it's about having 1.2 more physiotherapists and a little bit of a social worker. What we're talking about is skills, and we're trying to sort of map that from a sort of top-down strategic perspective, from a bottom-up competency development approach, and talking to people that we can work with to encourage that approach. So we were able to come up for them with a high-level strategic workforce plan rooted in a service transformation, embedded within a population health sort of dimension, that gave them the outlines of the whole-time equivalent across a large sort of county area that could enable them to start to both cost the system, but also importantly to think, well, if this is going to happen over 3 to 5 years, then there are different opportunities here in terms of recruitment or upskilling. Are we relying on our local workforce? What's the shift going to be between the hospital staff and the community staff, etc.? And that gives them their start of a 10. And because it was integrated, it was also able to produce the sort of high-level indication as well around beds. There was outpatient appointments, which would be about capacity in the hospital. And what is often the case in the models is that we can then apply some simple sort of cost, not in order to say this is precisely what your cost will be, but to say, is it broadly affordable? Before we go into the detailed number crunching that the finance guys will need to do and the individual costing, etc., if we can say that there's a £4 million saving, but that then needs to be invested in £2 million worth of staff development and training, then that seems like a goer. And you've got a sort of outline map. So that was cardiorespiratory services as an example. An engagement process, the linking between the activity, the needs, the workforce, using that model, but using it as a way of engaging and having a conversation with the client. Questions? 10 minutes left, that's okay. So we have a few questions there, and we can see whether we dip into anything else, depending on the questions. Yeah.
One of the sort of inputs of the point of that first conceptual model, Peter, was in effect demand on the system.
Yeah.
Have you looked at how that might change
Yeah.
if you change the capacity to meet that demand? Say, fill the M25, it fills up.
Right.
So are we having that effect?
Yeah. So you would have those conversations. Certainly the strict sort of demand drivers, the needs-based stuff. So we've had the conversation in a number of places where we produce the first example that you didn't vote for was around population health needs. When we look at the underlying change in population health needs and its impact, potential impact on services, and compare it with the recent trend in demand, what's actually hitting the front door, we know that what's hitting the front door is in excess of what you could legitimately, from an epidemiological perspective, say is genuine need. So what's happening? What's happening is people's expectations are changing. We're messing with the system so they're confused and they bounce around the system, so they occur more than once. Lots of things are happening that mean the difference. So that's about behaviours, and it's about sort of don't mess too much in terms of system transformation, but it's also about then how you signal within the system what's available. When we do the training, we often use I mentioned earlier the sort of archetypes. If you've heard of the fix that fails, we often use the waiting list conundrum as a typical fix that fails. The nature of a fix that fails is that you've got two sort of interlocking cycles that are happening at different time scales, and the impact of one isn't felt until the second sort of takes over. So in a waiting list situation, you have a high waiting list. You have an intervention that reduces that waiting list, which is a good thing. But then that lodges in the minds of the referrers, who think, oh, well, that means that we can refer those people that we were holding off for. And so actually your referral rates go up, and they go up over a sort of slightly delayed time. So you think that you're all right, and you've sort of hit your waiting list target, etc. And then 6 months later, it's going up, and it's going up even faster than it was before, because you've got something going on in the system of feedback and change in the demand. So you can both conceptualize. It's very difficult to actually sort of quantify that and say this is the behaviour of that general practitioner or whatever, but it is that very sort of mushy field of demand and demand management and human behaviours. Yeah.
Just wondering, towards the end of the engagement, what steps can you or do you take to keep the use of the model going or engaged?
Okay. That depends in part on the purpose of the model, because it shouldn't necessarily be assumed that the model has a shelf life. The model may have served its purpose as visualising, quantifying and setting a direction. So that's the first thing to say. One shouldn't presume that it will have a life. If, however, the model has been built with and this is better. It's a more sort of embedding process, because the model in system dynamics we often talk about the model as an iterative process, as a sort of way of learning, because it's thinking ahead, thinking about how you expect the system to behave, modelling it, recognising the difference, working out what, and then coming back to it. So we've often, but it still tends to be sort of periodic. It's about going and working with the outputs of the model, and then coming back after a sort of safe period, because it's a strategic high-level model, coming back at a safe period and saying, well, did what we expected to happen? And if not, why not? Now, the model, as we've heard this, well, every model is wrong, it's just that some are useful. And sometimes it's, well, we got it so wrong that we just need to go back to sort of starting point. But often it's just a case of saying, well, we now know some better intelligence about the impact of A, for example, on that ABCD example, because we were only guessing, because we couldn't do anything better. We had an informed guess with all the right people in the room, and we thought the impact was going to be 20%. Turns out it was only 10. That's why our behaviour over time graph is changing. So let's go back and revisit it, because that might actually undermine some other sort of impacts elsewhere in the system. So if that is the case, what does it mean for our workforce? Are we now running too fast or too slow on our workforce? So you're going back at periods to learn, rather than sort of taking it with you as a detailed monitoring tool, if that helps. Yeah.
I'm curious, so when these models are used to inform decisions, so senior level stakeholders making decisions, to what extent do they really understand the underlying dynamics of the model?
Okay.
And how do you prevent them from just using the model and the conversation that ensues as an excuse for doing what they want to do anyway?
Okay. There are regular occasions when models are built to help people to do what they want to do anyway. And that can then be a challenge to the consultant, because if you work out that actually that's not a good idea, you're in a sort of smally ethical position, and I have been in that position where I said, well, actually what you want to do is not a good idea. But often the models are, this is our hunch, help us to work out how that will work. And your job then is to help them to see how flexible and fluid the output is, rather than, again, the sort of the fixed bit. That's the second part of your question. The first part of your question was...
to what extent do they really understand it?
Right, to what extent do they understand it? I think that's a tiered approach, and it's a nature of the relationships within the system, which is one of the reasons why we got into sort of whole relational thinking side, because you've got to have. So in an example that's in my mind, you've got a director of finance who gets the systems thinking and wants us to do it. He wants us to do it primarily because it engages with the people that he thinks are important that haven't had an opportunity to sit around the table. So he understands basically how useful it would be. It's then important within those sort of stakeholders around the table that sufficient people understand what's happening under the bonnet to give confidence to the others. Now, none of them will be sort of expert model builders, but the case of the Kent's situation is that we are building capability to be able to challenge anybody internally or externally about how the model works. So one of the more advanced learners, if you like, within the Kent system has gone under the bonnet of the models that I've been building and said, I think that could be done differently. We've had a conversation and we've changed it. So you can see there that there's a director of finance, there's a senior analyst who's engaging, and there are sort of various stakeholders in between. The stakeholders can have confidence that it's their analysts that are providing the assumptions, and the senior client can have confidence that people are actually working together to solve this rather than just coming up with competing sets of assumptions. So that's the value, and that's the sort of that's the level of engagement that you want to get to. You don't always get it. Time for one or two questions more, and then I won't go any further into the presentation.
I've got it.
Yeah.
Go on.
Yeah, Peter, I was just looking at the different modelling paradigms. You're using system dynamics as opposed to maybe event-based simulation. Within BT, I use event-based simulation, and I'll start with the inventory of BT's network, and I'll just bring it alive. But by doing that, what I can do is to extract patterns and effectively move seamlessly into SD to the features, right? Or if I want to generate dynamically the operating plan, okay, I can build operating plans that will change the state of the business for the next kind of period. I can feed that back through inventory and dynamics and that. And then test it. So I'm actually modelling, using the model on an ongoing basis to be able to manage the entire operation. You know, and within that, I've got it interlaced with the VSM. Of course, if I want to make changes to an operating plan, I've got to do it through an organisational structure. So everything. So I'm using all of these different sort of paradigms all stitched together seamlessly. And then you can manage the business overnight. You know, year after year, putting learning back into the system, into the rules. Either instead of engineering rules and business rules, it works straight that way. So, in terms of your next steps, why couldn't you do something like that? On the assumption, of course, you feel there would be benefit in doing so.
I suppose, we've got to take, so if we take BT and sort of slot that model into the NHS, you have obvious reasons why that might be more of a challenge in the NHS in terms of different organisations, data quality, availability,
I've been through all that pain as well. And it's taken
and I'm
years
sure,
to get there. But if you're determined, you'll get there.
Well, what I'd love is a stable local NHS and social care community in which one could spend 5 years without everything sort of falling over every 18 months. So no, I see that that's possible. I'm not sure that the NHS and social care is stable enough. Not denying that BT will be a sort of a rapidly changing environment as well, but its structure and its governance and the likes lends itself to being able to do that. And Patrick, maybe the last question.
It's a sneaky one, really. And do feel free not to answer if it's too critical or embarrassing or whatever. Kim Warren's quite keen on sort of missing out the causal loop model and going straight to stocks and flows. I'm just wondering why.
I'm completely flexible. I use causal loop more as an explanation after the model building than as a route into the SD modelling.
Is it more accessible for people, do you find, in the stocks and flows? Or
I think generally it is, but people come with a certain expectation. So if you say you're going to build a mathematical model and you suddenly start talking about influence diagrams, then they can turn off very quickly. So I sort of bend to the Kim Warren view of the world in that circumstance and say what we need to do. But I'm very quickly, as I hopefully demonstrated in the first two slides, I'm very quickly into saying please be aware that what you're seeing here, if I've gone into that two-stop model, what you're seeing here is delay and feedback, and let me just show you an influence diagram that will recognise that, and this might be a helpful way to communicate the nature of the system behaviour to people who aren't doing the modelling, because that's so, and we can use that sort of simple influence diagram without ever talking about system dynamics modelling. But we know that there's a route. If that sort of catches on as an idea and a thought, then you're sort of leading people then towards the possibility, not necessarily the necessity, but the possibility of saying, well, there's some quantitative modelling that could help you here. So I'm very pragmatic. I know Kim's view, and that's fine. And my,
Well, I think
my
it's more to do
practice
with
is that I'll use
technical
it
practice rather than the engagement process
Yeah.
in Kim's world.
Yes, yeah.
So I
We
mean,
don't see perfectly eye to eye, but we have a good drink and talk about it.
thanks.
Okay?
Thank you. Peter.
Great. Thank you very much.
Thank you very much.